So this is the 20th anniversary of the Systems Thinking in Action Conference, and I will confess I missed one. If I recall, it was because we got into an unavoidable conflict of me having to be in China at the time of the conference, and I think we did a video for that one. So it's always been a highlight of the year because it's the largest public conference that draws together people now, increasingly from all over the world, who are really involved in the application of systems thinking and all the related disciplines for organizational learning and change in a wide variety of different types of industries. So the core was always traditionally business. Over the years it's grown, so there's a lot of public educators, primary, secondary school educators, as well as university, more and more people in healthcare, and more people in civil society and in community-oriented application context. So it's always been the gathering for people doing this as opposed to talking about it or telling other people to do it. I think that's what's kept it vital over the years because the core tools and principles have been there for a long time. There's always advances, new practical tools, new ideas that get integrated into the kind of core body of methods. But what keeps it fresh is that people are moving along into whatever are the most topical and important issues. A good example today would be all the tumult around healthcare. And not just in the United States, those of us in the U.S. are acutely aware of really the crisis state of our healthcare system, but it's not just us, it's true of all the advanced societies with aging populations and increasingly expensive means of treating health problems, from drugs to all kinds of surgeries and very expensive diagnostic equipment for an increasingly aged population. This is the kind of natural systemic set of problems that create a breakdown in a traditional system. The need in healthcare is very simple and it's inherently systemic. We need to think about health. Health is a systemic phenomenon. What makes you or me healthy is not just what diseases have popped up now, it's how we live, it's how we work, it's what we eat, it's our exercise, it's really the totality of how we live. You could argue that some of the biggest stakeholders in improving health are businesses because they suffer both the absenteeism but the low productivity of people who are not in a high state of physical, mental, emotional health. But you have to look at it very systemically to invest in how do we help our people be more healthy. Some companies do that, a lot don't. A lot keep putting all this stress and pressure on people and then say, yeah, you should exercise and eat well. Oh, but by the way, we have meetings at breakfast, lunch, and dinner. So that's an example of how the systems perspective is, if anything, more relevant today than it was 20 years ago, mainly because the issues are getting more acute. And the same thing can be said of individual organizations who struggle with all kinds of problems of how to balance the short term and the long term, how to have more effective product development processes that don't just focus on the crisis of getting this product out the door. And certainly the same is true of education. One of the more interesting developments now that's really coming to some maturity in the last 5 to 10 years, maybe 5 years, is the work of a growing network of educators in the United States to truly have a systems-based system of education, starting in kindergarten, starting K-1, 2. I will tell you, when you see 6-year-olds sitting around and talking about how they need to understand the system they create on the playground when they have fights, and how they could intervene to change the system they're creating. And they've got a little system diagram sitting at the table that they're talking about, and I will show a video of exactly this. It kind of blows your mind that 6-year-olds could reflect on the systems they create, and it leads you to wonder very naturally, what would it be like to have a society where kids grew up understanding the systems we all create, and stop pointing fingers at each other and start thinking about how they need to act differently, individually and collectively, in order to create systems that are truly healthy. That's always been the ultimate aim of the Pegasus Conference and all of our work in this field, how to create health systems that truly produce health and well-being, social, ecological, and economic. And the Pegasus Conference is still the best thing around, best meeting in the world to come and find out about how to do that.